How to unblock a feeding tube. Unblocking with warm water. You will need a 1 ml slip tip syringe, warm water, and a 5 ml slip tip syringe. If your child's tube has an adapter or extension, change this first. Step 1. Fill a 1 ml syringe with warm water. Step 2. Connect the syringe directly into the feeding tube. Step 3. Unclamp the tube. Step 4. Use a pulsing push-pull motion to clear the tube. Step 5. When the tube unblocks, flush the tube with at least 5 ml of water. Unblocking with pancreatic enzymes. Pancreatic enzymes require a prescription from a healthcare provider. The pancreatic enzymes contain pork products, so may not be suitable for all patients. You will need a 5 ml syringe, a 10 ml syringe, gloves, water, 1 capsule of pancreatic enzymes, such as codazyme, 1 tablet of sodium bicarbonate, 325 milligrams, a pill crusher, and a medication cup or bowl. Step 1. Wash your hands with soap and water and put on a pair of gloves. Step 2. Open the pancreatic enzyme capsule. Pour the powder contents into a medication cup. Discard the outer capsule. Step 3. Crush the sodium bicarbonate tablet until it is powder. Step 4. Add the sodium bicarbonate powder to the pancreatic powder in the medication cup. Step 5. Add 5 to 10 ml of water and mix the solution in the medication cup. Step 6. Draw up the solution into the 10 ml syringe. Step 7. Push as much of the medication solution into the tube as possible. Step 8. Let the solution sit in the tube for 30 minutes. Step 9. Attempt to flush the tube with at least 5 ml of water. If your child is younger than 1 year old, only try this procedure once. If your child is older than 1 year old, you can repeat the procedure one more time immediately after the first attempt. Step 10. Once the tube has become unblocked, flush with at least 5 ml of water and continue with your feeds and medications. If the tube is still blocked, contact your G-tube specialist right away, or after hours, go to the emergency department of the hospital that manages your child's tube.